Hi, I'm Dr. Joel Marley of Family First Chiropractic, and I'm here to demonstrate how Family First Chiropractic gets such great results with correcting the cause of knee problems. Now, if you're experiencing pain in your knee, now the knee is a complicated joint. Now, the nerve supply to the knee, which for pain to exist, there has to be some sort of inflammation component to even perceive pain, the lack of mobility, the lack of alignment. For you to even feel that insinuates that there would have to be pressure on a nerve somewhere. So our job is to determine where that is coming from. First of all, we would start with a thorough examination of the pelvis and lower lumbar spine. So the lower back is indeed the nerve supply. It's the vital component to supplying, healing, proprioception of the knee joint. So by checking the alignment of the pelvis, the heights of the two hips and how the legs would touch the ground, ambulating, walking up and down stairs, maybe bending down, coming back up, maybe during a workout, maybe doing super mom duties, getting down on the floor with children, back up, maybe going down in a repetitive lifting habit like deep squats or lunges. And if there's problems in the knee and the hip, our job is to determine where it's coming from. So by checking the alignment of the ilium and then checking the nerve supply from the lower lumbar spine as well as the SI joint, the sacroiliac joint, because if the pain pattern, you're experiencing pain that travels maybe down across the knee, maybe if the pain travels past the knee, that is an indicator that that may be not a knee issue. That could be a referred pain from the lumbar spine, SI joint, or ilium, or all three. So in this example, we determined that this patient has a true knee issue. Okay, so a thorough examination. Commonly we'll take x-rays if necessary to determine the alignment and the stability and the motion of the knee. But I want to demonstrate how an adjustment is delivered as well as the assessment. So by assessing the knee, we're going to first check how the ligaments, how the supporting structures move. So in a lateral to medial, which means a gentle pressure testing the middle of the knee, which is the medial or the medial meniscus, we'll apply a light, gentle stretch, a light, gentle test of the joint. And in this motion here, we notice that when she stands, when she walks, her toe tends to point out, and the pain is directed right to the middle part of the knee. So for this example, a medial knee pain, medial meniscus pain, and then the alignment showing a wedge. So with a wedge on the medial side indicates that the joint isn't swinging, the door isn't swinging, it is not swinging closed flush, it's actually veering off to the side. So this motion is relatively easy because it's already stuck in this position and it elicits pain. Now, when I go to check the reciprocal of that, a medial to lateral, gentle testing right there, it's indeed stuck. It will not move into a valgus, which is a stress aimed lateral word, which is basically the medial meniscus and the wedge. So an adjustment's delivered by contacting the femur in this example. AIN is the listing, anterior rotation, and internal wedge. So there's a wedge on the medial side. So we'll be contacting the medial part of the femur and directing a force from anterior to lateral to correct the misalignment of the knee and then help this patient femur, tibia line up so she can get back to doing her super mom, her super workouts, her super CrossFit workouts, whatever it happens to be. So the force is delivered right here, a gentle force, just like that, through the joint plane line to help these two joints, thus making up the knee, work better. Now, we adjust a lot of knees and help with a lot of patients, young athletes with knee issues, and this is how we achieve it. This is how we assess it at Family First Chiropractic. I hope this helps. If there are stretches, if there are exercises, if there are to-dos, and there's some to-don'ts that you're interested, check out our other videos. I'm Dr. Joel Marley with Family First Chiropractic, and we look forward to seeing you around.